Postpartum conditions, what are they? Let's talk about them. Postpartum conditions are mental health complications to the whole perinatal process. And what we know about the perinatal process is it includes pre-pregnancy, during pregnancy, and postpartum, which could be 1 month, it could be 1 year, it could be several years. So postpartum conditions are mental health complications to the perinatal process, and it comes with a lot of different nuances, a lot of different impacts, a lot of different challenges that we just don't know about. And because of the society that we live in, because of the imposed productivity that's expected, because of how quickly we're supposed to shake back and get back to business as usual, life as usual, we put a lot of pressure on ourselves. And also we suffer for extended periods of time because we don't know what we're actually dealing with is a mental health condition as a complication to the perinatal process. And so we're going to unpack what all of that means in this next episode of Mental Health in Our Community as we tackle postpartum. Welcome back to Mental Health in Our Community, y'all. We are really getting ready to take a deeper dive into postpartum conditions with Dr. Akilah, who has just educated us in such an amazing way and gave us some real understanding of risk factors and what is postpartum, what is the perinatal phase consist of, what are some of the risks, what are some of the conditions. And now I want to take a deep dive into what is some of the treatment look like. So as you were talking, I was reminded, I'm not going to say my political views on this, but one of my favorite movies growing up was Look Who's Talking. Okay. Part of this probably is because we didn't have cable, so we had to watch the same movies over and over again. And I love Look Who's Talking. And so on Look Who's Talking 2, or maybe Look Who's Talking and Look Who's Talking 2, Debbie Allen is sitting there watching something similar to what would have been in that time, right? And they're talking about postpartum depression and what could happen to moms. And she's like, well, that's not gonna happen to me. Then the next scene is her having the kid and then sitting on the sofa crying because it's happened to her. And so I felt like that was a funny way to showcase, like, yeah, we listen to these signs, we listen to these risk factors, we listen to these conditions. We think it's not gonna happen, but sometimes it does happen. And so when it does happen, let's talk about one, what does that treatment look like? But I really want to talk about the myths, or maybe even some of the beliefs, because you talked about the way in which the society doesn't set us up for family. So we've internalized what that is that I think can sometimes, at least I've seen in my practice with my clients, can prolong our recovery. So when we find ourselves with either baby blues, or maybe baby blues have subsided, right? Because we know that that's about 2 weeks. Or we find ourselves with postpartum depression, postpartum anxiety, postpartum OCD, postpartum bipolar. What does seeking help look like? Who diagnoses these conditions? And then let's talk about treatment after that.
Okay. Should we talk about the myths first or who diagnoses first? What do you think?
Let's talk about who diagnoses, because I don't want us to self-diagnose.
Okay.
I don't want people to watch this say that.
So I like to say that clients, you all, people who've given birth, who've had kids, you know yourself the best, right? You've been with yourself. So just pay attention to these shifts and changes. And also, I really like to talk about the importance of the community. So the partner in the person's life, the family, the friends. So pay attention to what you learn about these perinatal conditions, postpartum conditions, specifically given our topic today. And if you start to notice shifts and changes in your loved one, or if you yourself start to notice that something just doesn't really feel right, this is the time to go speak to someone professionally for support. Who diagnoses? So there is a push in our field to ensure that mental health providers are provided education on this. I would like to say I support this because I don't know that there's been a lot of education on perinatal mental health conditions for all the providers. How people might get acknowledged for potentially having it, so meaning screening. Some people think OBGYNs have the responsibility to screen. Some people think it's other people. The tough part is if you don't have a mental health provider before this, then how are you going to reach one, right? So you do need frontline health providers to be screening. And so the guidance is anyone who is in contact with someone who has given birth or who is pregnant should be screening.
As a professional.
Professional.
Okay.
In a professional capacity. I'm not saying every person on the street needs to screen.
Right.
One of the screening measures that we have is the EPDS. Don't ask me to pronounce the word, the Edinburgh. Is it Edinburgh?
I love it.
Postnatal depression screening. So this has been
Mm.
a screening that has been validated to screen for postpartum depression. I think also some anxiety symptoms in there, not just for mothers or women, but also for teens and also for fathers.
Mm.
So
Mm.
screening is really important. This can be done by OBGYNs when a woman is going in, or a mother or parent is going in for a checkup postpartum. It can be done at pediatrician appointments, and I have seen this being done at pediatrician appointments. So when a mother or a caretaker goes in and takes their babies for those regular baby visits, well baby checks,
Ah.
sometimes they screen moms or parents during that phase. Very important. And then if you've already had a mental health provider, then I would encourage you to reach out to them, because
Mm.
these are the people that can diagnose.
Love it. Love it. Love
So
it.
so
Well, I
mental
like the
health.
comprehensiveness. Go ahead. I'm sorry. I'm
Yeah,
just
oh, no,
thinking
no.
about I never
So
even
mental
considered that.
health providers diagnose. I do think, your OBGYN might be able to diagnose you. I don't know if a pediatrician would diagnose you, but they might screen and they
Mm.
might refer you to another provider. If you're screened as positive by your OBGYN, they may refer you, or even your primary care doctor, they may refer you to a mental health provider to get additional treatment, but they can, like, I presume physicians have the responsibility as well to be able to screen and diagnose and then refer to treatment from a mental health provider, a licensed mental health provider,
Okay.
psychologist, psychiatrist, licensed marriage and family therapist, licensed professional clinical counselor,
Mm.
licensed clinical social workers. Anyone who's a mental health provider that has a license can diagnose and provide the treatment if they feel like they're able to provide that treatment for you, given their background and training.
What I love is that there are so many ways in which you have educated people and empowered people to be on the lookout, right? To look for the signs, to look for the warnings, to understand that one of the key indicators is those symptoms, but the duration of those symptoms. How you've empowered not just the mom, but the partner and community members and people around to also be bearing witness to encourage. And then what I love to hear in this healthcare system is that there is comprehensive, right? We have different people who are on the front lines
Hmm.
who can screen and then screen and like kind of funnel you, because we know that the healthcare system can be burdensome, it can be very
Yeah.
challenging, it can be very difficult, but to screen and then get you into care with a licensed mental health provider to be able to now address these symptoms. So let's talk about that. Let's get into now. You recognize, you've heard this episode, you recognize you've had some symptoms, you've been screened, you've been diagnosed. Now, what does treatment look like? And then I'll talk about some of the myths and kind of throw that in, because I do feel
Okay.
like part of that disrupts the treatment, unless you have a really solid, mental health provider. So, what does treatment for these postpartum conditions look like? Is it universal? Is it different for the condition? What is it?
Yeah, I like to think that treatment is personalized for every person, based
Mm.
on what they're presenting with. Someone might be diagnosed with multiple conditions too, and so it's important that
Mm.
you get screened and assessed, and then whatever your provider determines is the condition or set of conditions, then you're going to get some specialized treatments. So if you're looking for medication, or if your provider thinks that you might need medication, then that would be provided by someone who has prescribing privileges.
Mm.
Typically, that's a psychiatrist who is a physician that has gone through additional training in psychiatry to be able to prescribe.
Yeah, we had Dr. Dixon on here to talk all about psychiatry
Okay, good, good, good.
101.
So sometimes, maybe your PCP might do that as well. What mental health treatment looks like. CBT is often on the front lines of treatment, especially for depression and anxiety. CBT is just cognitive behavioral therapy. What I appreciate about it is that it helps people to identify thoughts. Thoughts are really
Mm.
powerful, and thoughts that tend to be negative, anxious, depressive kinds of thoughts
Mm.
that may put us in these downward spirals and
Mm.
contribute to the condition that you're experiencing and the worsening of symptoms. So
Mm.
you might get some support with helping you to reframe or to challenge these negative or depressive, anxious thoughts that you're having.
Mm.
I love behavioral therapies where
Mhm.
you are encouraged to be active in what you do. So something called behavioral activation specifically for depression. That's a fancy psychology word, and it just means doing things when you are active, when you are doing things, usually it helps you feel better.
Mm.
I love when I'm working with folks to have their own internal and external sense of how they're doing. They need to be able to
Mm,
monitor. It's called self-monitoring. So
mm,
you might develop a scale with your provider that looks like on a scale from 1 to 10. And in my practice, we have a mental health rating scale from 1 to 10, but it might be a depression rating scale from 1 to 10. Whatever it is, you have one anchor, which is highly symptomatic, meaning feeling very depressed or very anxious. On the other scale, it's the opposite of that. Maybe you're really calm, you're not feeling anxious, you're not feeling depressed. The reason why I like to have folks have a scale like that is that when you are out and you're not in therapy, which most of your time you're not going to be in therapy, so you need to have your own sort of personal screening
mm,
monitoring practice, especially when you're doing things like behavioral activation. So what that
mm,
means is doing pleasant activities, doing productive activities, doing just something to get
mhm,
yourself out of the house, in the sun, hanging out with friends, being social. And
mhm,
most of the time, what I notice is that when someone does something, they may not feel like doing something, they may not want to do it. But
mm,
once they get into the action of doing it, that rating scale tends to go up. So they were
mm,
feeling down or depressed, and they may still be feeling down or depressed, but not so much. And what we want to see is incremental change. So those are
mm,
some sort of treatments for the depression, CBT. When it comes to things like OCD, the gold standard is what we call exposure with response prevention.
mm,
Essentially, OCD, you tend to have these unwanted thoughts. A lot of times when it comes to the postpartum phase, there are thoughts about harm to the child. There are thoughts about often contamination, and then there are thoughts around like accidents happening. Again, harm to the child, but for accidents. So what we know is that again, thoughts are thoughts. If you have OCD, you don't want these thoughts to happen. You're not wanting that. It's probably pretty scary, and that's where the anxiety comes into play. And
mm,
that's why you do compulsions, which are rituals or acts to try to prevent
mm,
the obsessive thought from happening.
mhm,
Exposure with response prevention basically kind of turns that on its head. Instead of avoiding or doing these compulsive activities, it is essentially exposing you to the anxious thing to see that it's not happening, like it's not going to happen.
mhm,
And it allows you to, and you also learn skills to kind of tolerate the level of distress that you are experiencing. A lot of
mhm,
times OCD treatment is also matched with things like mindfulness or acceptance based therapies, which provide folks with skills to be able to
mhm.
be in the present moment. Relaxation skills can be helpful. I want to
And
pause there
Dr.
because I
Dixon
gave y'all
had
a lot.
mentioned in his episode SSRIs for OCD when we were talking about
Mhm.
the different classifications for medications and common ones. He talked about SSRIs being one of the gold standards for OCD as well. If again, if that is warranted, we don't know what other people's conditions are. We don't know if they have a prescribing provider in addition to exposure with response prevention, mindfulness, and behavioral things. I think that medication intervention can be one of those as well.
Absolutely, absolutely. And in many cases, what we know for treatment is sometimes like the gold standard ends up being the medication and the
Hmm.
treatment together.
Hmm. Hmm.
So I think I would encourage folks to be in consultation with their prescriber. Again, I've heard a lot of women who are afraid to take medication. And
Hmm.
so again, I want to say that there are behavioral treatments that you can receive, but also sometimes medication is helpful. And that is a conversation you should definitely have with your provider so that you can go over the risks and benefits of it.
Mhm, mhm. And that's what Dr. Dixon said when he was here. He talked about, that it's comprehensive for him. Psychology is an equal part. I think he said that medication is only a third of the treatment plan. And that like habits he talked about, as well as
Mhm.
psychology being the other two, and the habits being rest, being hydration, being movement, and then psychology being a complete package. And so it's like this comprehensive approach where I think that there's a lot of different myths and a lot of things that may stand in people's way because they feel like medication, they hear that and then they like nope, don't do it, but it is
Yeah.
a comprehensive package. So we're talking about, I love what you said about the behavior activation, like you said, our fancy word for getting moving, CBT challenging those thoughts, like the medication helping with any pre-existing psychiatric conditions or just the biological chemistry, the stress response that's happening, and then the more mindfulness, skills based practices. When we're talking about postpartum psychosis, that's more of an inpatient treatment, right? So, what does that
What is that?
generalized?
Yeah, I would say if you experience if someone experiences like psychosis in the postpartum phase, again, it's a medical emergency. I would refer
Mm,
them to be assessed and be assessed essentially. I would presume that probably medication is going to be a part of that treatment. Establish like I think, I hate to, I don't like to move into the phase of medication because I'm not a prescriber, but from my understanding, you probably will need to, it probably is most helpful to have medication and a comprehensive treatment plan that
mhm,
you are, working closely with your providers, whether that be a psychologist or a mental health therapist and a prescriber. It may require some inpatient support and care to establish safety, or it may be that you have a comprehensive plan with family members who are available to provide perhaps 24-hour support while you are
mm.
stabilizing in the community. So it's an individualized plan, but you definitely need to get some emergent support right away to make sure that we establish safety.
Okay. Let's get into it then. So let's say a person has been, like I said, they've been diagnosed, they're in the throes of treatment. I'm thinking about some of my moms who have been in postpartum depression, postpartum anxiety, and we're working through it in treatment. And this is what I actually was able to consult with you about. And they have internalized this worldview of we should be productive. And again, we want to give a fault where fault should be. It's not on
Yes,
my client, it's on the systems that we work in, it's
exactly.
on the hustle culture, it's on capitalism. And so they are judging themselves after a significant life event where the chances of a mental health condition as a complication post birth is highly likely. And then they're in treatment. And I feel as though they've internalized guilt, worthlessness, self critique because they're experiencing depression, because they're fatigued,
Makes me
because they
so
can't get
mad.
back.
Yes.
They can't get back to their baseline quicker. So, what are some of the common challenges? I was going to say myths, but maybe myths as well as just
Yeah.
internalized thoughts that people have that you feel show up in treatment that we want to kind of debunk or dispel or reframe to give our moms some self-compassion with themselves to be able to recover from such a significant life change.
I want to keep harboring on the term recovery
Okay.
because that's what this stage is. And
Mm,
recovery, the postpartum period
mm,
is up to a year or more. And so recovery is so real. And I feel like rest and recovery is huge. And that needs
mm,
to be at the top of our conversations, whether someone has a condition or not, and should be a part of the conversation and
I
vernacular
love that.
from I think starting during family planning, because I will
Mm,
say that people experience prenatal depression, anxiety, and conditions, which can be alarming to many folks because we're not always thinking that we're going to have some sort of prenatal condition. And then in the postpartum
mm,
period, also complication of pregnancy, delivery. So rest and recovery are key. I think that society, again, it makes me so mad. And I always talk about this with my clients because that's where I put the blame, the burden on this, but the burden becomes on us. But I think the blame is on society, that there is this expectation that
mm,
after someone has a baby, you just kind of bounce back. You
mm,
snap back, you get back physically, but also in terms of work and even socially, like socially, and like you just get back to who you are. And
In 6 weeks.
in 6 weeks, if you're
Whatever,
lucky.
or whatever maternity
Let's
leave
be
is.
clear that in California, that might be a privilege that we even get 6 weeks
Mm,
of disability leave, and then we get some family bonding time. That's a
mm,
privilege. And not even everyone in California has the privilege of taking all
mm,
of that leave, or it has access to it. So
mm.
that needs to stop. I'm sorry. Like
No, go ahead, go for it,
that's got to
girl.
stop. We definitely need this. I like to think about other cultures who we can learn from.
That's
I
good.
can't remember the exact culture, but there are some cultures who have this thing. I think it's called staying in.
Mm,
And it's this idea that perhaps in the first several weeks or months after someone gives birth, it is a part of the culture where a mother and her baby are in the house and they have all of their needs tended to and cared for. They
mm,
are just the family, the support, the community is there, and mothers do not have to think about where their meal is going to come from,
Mm,
washing their clothes. And I
mm,
think we need to really think about bringing these kinds of supports to families and parents here,
mhm,
because that is super important. We also need to look to other countries who have paid
mhm,
leave for 6 months, a year. I mean, we need to have real conversations in this country about what we need to support families, what we need to
mhm,
support mothers, what we need to support
mm,
birthing people, what we need to support fathers and non-birthing people, because it is an
mm,
entire family unit.
mhm,
And so I'm gonna stop right there, but like I
mm.
have to say that.
No, I think that that's so important. I'm glad that you took the time to say it because at the very minimum, as you're saying it, and I'm thinking like, yes, let's borrow from other cultures. Let's use them as an example. We understand what could be at the most ideal in terms of like family bonding time, 6 weeks of paid disability, maternity leave, paternity leave. We understand what the standard is. So if you don't have that, if you don't have that luxury, if you don't have that privilege, or you can't afford around the clock care, it is important to remind yourself that this is the standard. This
That
is
is
the
what you
best
need. And so
practice.
you're being asked to do something that is not standard. Like I think
Good
we
job.
think the standard is going back to work right away.
Yeah.
I think we think the standard is being able to stay up with your baby all night
Mhm.
and to feed your child. If you're breastfeeding, let's just say that that's a part-time job. So if
Mhm.
you are able to breastfeed and do breastfeed, but in any
Mm.
way you feed your child, it is important, because even if you just are, if you're not breastfeeding but you're bottle feeding, however you're doing it, like
Mhm.
it takes a lot to feed a child, to care for a child, to keep a child alive
Mhm.
24/7.
Mhm.
We just need to know that I think the standard is to be able to have time off, to be able to get cared for and tended to. Most people in this country are not allowed that standard.
Mm.
So we need to just get real in our mind about we are
Mhm.
being asked to do something that is basically heroics.
Mhm. And then working with your mental health provider to then help you reframe that and
Yes,
personalize what your treatment will look like with that in mind. And so for me with clients, it has looked like let's slow down, let's adjust our expectations. You're taking multiple naps throughout the day, and that should be the case in an ideal world. But for you, because you've internalized this standard, it feels like a failure. Okay, let's reframe that to my body is recovering. And if it needs
yes.
3 naps, let it get 3 naps. Let's try to couple that those 3 naps with just a moment where you were able to walk, behavior activation for that day, get out and get moving. And let's set small, tiny goals. If you feel like you can achieve something outside of parenting, because I think sometimes people get consumed in that as well, of feeling like all I feel like I'm doing is pumping, feeding, caring for this kid, and it's driving me nuts. And so, what's one small thing can you do? Me and my clients have talked about getting their nails done. That we talked about getting a pedicure. We've talked
Yes.
about getting their hair done. Small things that you can do that feel like a treat to you while you are recovering. Because, like you said, we know what the standard is. And if you don't have that standard, let's reframe, let's rethink, let's come up with a different alternative to support what would be a natural process should we have been afforded those privileges.
100%. And I think like you're talking about being able to reframe like your thoughts and your expectations and then making small steps. I love when you said slowing down. And I do
Hmm.
think that it is it could probably be really helpful during the recovery phase to slow down and to be okay with that. I know for many
Hmm.
folks who are used to being productive and out here and social and working and doing the
Mm.
thing, like,
That's
we're
an
used to
adjustment.
hustling
It's
and
a
bustling.
psychological adjustment. Yeah.
It
Hmm.
is an adjustment to not really have a lot of stuff on your plate. I mean, just taking care of baby is a lot in my opinion, but I think that's not what we're always thinking about. I
Hmm.
have heard conversations from moms who share that there's this belief that there's this perception that they think people on the outside or at work believe that maternity leave is kind of like a break from work. And that
Mm.
is mind-boggling, because it's not a break from work, it's
Mm.
recovery and it's
Mm.
bonding time and it's taking care of yourself.
Mm.
So I also think as a society, even those of us who are not having kids or who are not in that phase of life right now, we need to be really mindful of the people who are in that phase right now.
Mm.
Other basic things that we may not always think about, but I think it's a part of recovery, it's a part of treatment planning, the very basics: sleep,
Mhm,
hydration,
mhm,
nutrition.
mhm,
Sleep deprivation is so common and so big in the postpartum period. And sleep is also indicated in a lot of the disorders we talked about: anxiety,
mhm,
depression,
mhm. That's good.
bipolar disorder. So we need to come up, I would encourage folks to try to figure out some sort of sleep plan
Mm,
that I know for many women or for many folks who have kids, like they have to be up and feed their child during the night. But in some way, shape, or form, come up with some ideas from your support system and for yourself to figure out a plan for you to at least get some chunks of sleep.
mhm, mm.
I would say the longer chunks you can get, the better for you to at least get you through a sleep cycle or 2. It's hard to be disrupted in those sleep cycles.
Okay, so then I love that sleep, hydration, and what was the third one? You and rest, obviously,
Rest,
and nutrition.
nutrition, making sure
Mhm,
you're able to eat. When I remember, like, just thinking about food and what I was gonna eat, it was mind-boggling to me,
mhm,
like, I don't know, I need to eat, but I don't know what to eat, so taking that off of people's list for family members and friends who wanna think about how can I help someone, a
mm,
meal train, I think, or being able to provide meals, to do laundry, to do some of those tasks in the home, and if
mm,
someone who's had a baby asks you to do those tasks, I would not take it personal, like they don't care about you or they're trying to make you Cinderella or whatever. I would like think about it as this is actually for many folks more valuable than a gift.
mm,
It is for some people, it's even more valuable or and when I say valuable, I just mean like it means a lot more to them in their daily lives right now
in
than
their
getting you
recovery.
gifts and their
Mhm,
recovery. Even sometimes people think, well, let me go and hold the baby. Everyone wants to hold the baby, right? But also for some
mhm,
people who have a mental health condition, this idea of people in their baby space or
mm,
just in the recovery phase, that may not actually be what they want or what they
mm,
need. And
mm.
something like household chores or daily chores actually could be really, really helpful and could be a sign of love or care.
Listen, this has been so transformative. I genuinely mean that. As I'm listening to you, I'm thinking about myself as a clinician, as a provider. I'm also thinking about myself as a future mom. I'm also thinking about myself as a person supporting moms and what could be, how can I could be a part of their treatment plan. I'm thinking about
Mhm.
as a provider how I can assign a treatment plan based on the people in those people's lives. I'm thinking about
Yep,
myself as a mom, like who's gonna be a part of my treatment plan, and then I'm also
exactly.
thinking about how I'm operating that in real time. And so I have loved this phase. I want to come back for
Okay.
our final segment with you and talk about your own journey to pursuing this specialty and your own experience with your perinatal phase, your postpartum phase,
Can I
and
add one thing after
yeah,
this?
and how this has been for you. Go ahead. Yeah, for
Sorry,
sure.
sorry, sorry. Um, Sunlight and getting outside and fresh air.
So that's okay. I like to give them numbers. So
And
yeah.
social something, so, some sort of social supports. That's okay.
Okay. So we got sleep,
Yes,
hydration,
yes,
nutrition,
yes,
rest,
yes.
sunlight, getting out with social.
Getting out the house, like fresh air, and then
Okay.
some sort of social something social, but definitely try to get out the house because I think sometimes I mean, for folks who are in that staying in period, certain cultures, you stay in the house at for a certain period of
Ah.
time.
Uh-huh.
And so, I'll defer to also your medical provider on when that is, but at some
Mm.
point, getting outside of the house, getting fresh air, getting sunlight, those natural elements, I believe can be really helpful.
7 critical things when it comes to recovery. I love that doesn't cost a lot.
Yes,
That
exactly.
doesn't cost a lot. All right, so y'all stay tuned. We're gonna come back and we're gonna talk with Dr. Keela about her journey and her perinatal process, her postpartum process, what led her to pursue this specialty, and the final words that she wants to leave to all active moms, aspiring moms. Stay tuned.